going to ask. So, in terms of diabetes, as we know, there are two types. We have the type 1 and the type 2 diabetes. With type 2 diabetes, the problem with this is that these persons are not producing any insulin at all. So their pancreas isn't working, so it's not producing any insulin when the sugar fills into the bloodstream. So anyone with type 1 diabetes automatically has to go on injectable or insulin medications. Those persons definitely have to stick themselves every day. Apart from type 1, we have type 2 diabetes. With type 2 diabetes, the pancreas still isn't working properly, but it's still working some. So it's actually, type 2, the kidneys is actually, the pancreas is actually able to produce insulin, but the insulin that it's producing is not enough to actually supply the demand of the sugar that's in the bloodstream. So because of that, we actually have medications that help and stimulate the pancreas, make it work better, to actually increase the amount of insulin in the bloodstream. So each of the medications actually work in order to help and increase insulin in the bloodstream or reduce the amount of sugar that's there. Now just so you get an idea, in terms of diabetes, there's certain goals that we're looking for when you check your sugars and you check your numbers. So if you do a fasting blood sugar means first thing in the morning before you eat anything or before any meals, we want it ideally between 90 and 130. If you wake up in the morning and check your blood sugar, once it's between 90 and 130, that's where we want it to be. If you do your blood sugar 2 hours after you start a meal, then we want your blood sugar to be less than 180 when you check it, okay? Also at bedtime before you go to sleep, we want your sugar to be somewhere between 100 and 140. And then we all know about the A1C, which is our goal target, which is a test we do to measure how well controlled the blood sugar is over a 3-month period. And we want that value to be less than 7%. So if you ever see your sugar in the 200s or above, those are the levels where we don't want it to be. So we need to bring it down. So the A1C, what I talked about, A1C actually equates almost to a blood sugar reading when you check it on your machine. So A1C of 7% probably is around a value of about 150. So that means for average, most of the days you average all your blood sugars, the average of it would be about 150. That's the time when you do your blood sugar control and you see an A1C at 12%, and you say, well, doc, my sugars was running around 150 all day. I know because it was 12%, your average sugar was actually much higher than that and was in the 300s. So it also gives us an idea of over the last 3 months, how high your blood sugars were running and what things we need to do in order to bring it back into the control range. So, now we're going to talk about the medication. In terms of oral medications, there are many different classes of medications that we can actually choose from. We have 7 different classes of tablets that we can use. We have the biguanides, the sulfonylureas, the thiazolidazines, the metaglycinides, alpha-glucosidase inhibitors, the DPP-4 inhibitors, and the SGLT2 inhibitors, and we're going to talk about each one of those separately. The first one up we're going to talk about is the biguanides. Biguanides is also known as Metformin or glucophage. Some persons may be on this class of medication. Most of the times it's the number 1 recommended for persons with type 2 diabetes to use. Now, how the metformin works? The metformin works 3 ways in order to help control the blood sugar. One is that it increases the amount of sugar that's used by the muscles and the fat tissue. So it allows the body to use the insulin better. So it allows the sugar in the body to be utilized, so it's less sugar in the bloodstream, and it goes to the cells where it needs to be. Another way the glucophage helps to reduce the blood sugar is that you have an organ in the body called the liver. One of the purposes of the liver is to actually produce sugar for the body, especially if the blood sugars is dropping low. So what the purpose of metformin does is it actually reduces the amount of sugar produced by the liver. So if it reduces that sugar, then there's less sugar into the bloodstream, so it helps to control your blood sugar that way. And last, it actually reduces the amount of sugar that's actually absorbed into the bloodstream in the intestine. So it allows more of the sugar to pass out into the feces than to be absorbed into the bloodstream. So it's less sugar for the body to have to deal with at any one given time. So metformin is actually indicated for persons with type 2 diabetes. It actually has been proven to be safe in children because nowadays we have more children because of childhood obesity and other problems that actually have type 2 diabetes. So now we actually need medications to treat them also. But it has been indicated for that. It actually takes a few weeks before you can actually see an effect on the medications, and up to a month to 3 months before we get the full effect of the medication. With the glucophage, we actually advise you to take with food because a lot of the side effects deals with the gastrointestinal or the GI system. So it can cause you to feel nauseated or feel like vomiting. It can make you feel like you have an upset stomach. It can also make you feel like you have to use the bathroom and have a little diarrhea with it. So because of that, to eliminate or reduce that side effect, what we usually say with the metformin or the glucophage is that you sandwich it in your meal. So you eat half your meal, then you take the glucophage, and then you eat the rest of the meal. When you do it like that, majority of the times, it eliminates the side effects from it for most persons. Metformin can be taken anywhere from once a day to 3 times a day. Usually if it's only taken once a day, it's usually taken with your evening meal or with the heaviest meal for those persons. Now with the glucophage, if you have problems with the kidneys, you actually have to make sure that your doctor is aware. And also if you're having any kind of studies being done like a CT scan or MRI, where you would have to receive contrast, you would also have to let them know that you're on glucophage. Because the contrast has to be removed from the body, from the kidneys, and when you're taking the glucophage, it can cause a problem, so you have to hold the glucophage for a while if you're going to do any type of procedure that requires you getting contrast. Now, even though I say you have to be aware if you have kidney problems with the glucophage doesn't cause kidney problems. But the reason why you have to be aware if you have kidney problems is that everything in the body is actually broken down by something. So when you eat something, it's either broken down by the kidneys or it's actually broken down by the liver. If the kidneys isn't working properly, then it can't be broken down effectively. So that means you would have more of that medication circulating in the blood, which would cause the levels of that medication to build up, increasing your likelihood of having side effects. So persons, once you have problems with the kidneys, then it's advised to let your doctor know, so he would know if the kidneys are still able to deal with this medication, or if it has to be removed, that you have to use a different medication, which actually doesn't have to use the kidneys to break down. So we finished talking about that class. It brings us to our second class of oral medications or tablets, which we call the sulfonylureas. Sulfonylureas would be medications like the Diamicron or the Amaryl some persons may be on. Now you see we have some numbers beside each of the classes of the medication. The numbers basically show they did several studies to actually find out with each class of medications how well it does in moving your HbA1c level. Remember we say the HbA1c measures how well control of your sugar is over 3 months, and we want that less than 7%. So let's say your A1C is 9. So this class of medication has been known that it can decrease your A1C by up to 2%. So it can move it from 9 to 7. Okay? So it just shows you how well it can be done to actually decrease your A1C. Now, so come we know that sometimes if your A1C is a certain amount, we know that you probably need more than one medication to actually bring your A1C down, because we know the effect each medication can give. So if we know your A1C is a certain amount and we need to bring it down by 3, then we know that we likely need a combination medication rather than just one medication to bring it to where we need it. So now we're talking about the sulfonylurea. Like I said, these are the medications like the diamicron and the Amaryl. These medications work by actually increasing the release of insulin from the pancreas. We call these type of medications secretagogues. So it actually allows the pancreas to work better and allow it to actually put more insulin out into the bloodstream. And as we know, insulin moves the sugar out of the bloodstream into the cells because the cells need the sugar to actually operate and for energy. So that's what it does. It actually stimulates the secretion of insulin. It also increases the amount of sugar that's actually used by the muscles. So it allows the muscles to use the sugar better. Again, it works at the level of the liver to actually suppress the amount of insulin that's being produced. So a lot of these medications, like I say, have more than one mechanism of how they work, and a lot of them work separately and differently, so they can actually be used together to help decrease your blood sugar level. So now, we're still talking about the sulfonylurea, the Amaryl, and the diamicron. They're actually indicated for persons, like I said, with type 2 diabetes, not for use in children. They usually begin to work about 15 to 30 minutes after you take the medication. These medications are usually dosed once a day, and is usually taken at least 30 minutes before a meal. Usually taken with your first meal, which is breakfast. Okay, and some of these medications, usually dependent if they're mixed, they're not taken alongside with other medications. So the sulfonylurea can be taken with other diabetes medications. So if you're taking a diabetes medication, you can take all of them at the same time. But certain other medications, you may have to wait 2 hours before you take the rest of your medication, depending on the interaction between them. Now, some of the common side effects that this medication or this group of medication cause is it can cause sun sensitivity, it can cause dizziness, it can cause hypoglycemia or the blood sugar to drop too low, it can cause headaches, or it can cause you to feel nauseated or like vomiting. So a lot of these side effects actually improve after about 1 to 2 weeks of taking the medication. Now the main reason why this medication can actually cause your blood sugar to drop low is because, like I said, it stimulates the pancreas to secrete more insulin. And it's the insulin which can actually cause your blood sugar to drop low. For the first medication that we discussed, the Metformin or the glucophage, it doesn't stimulate the insulin, so it's very rare for that medication to actually cause your blood sugar to drop. So, the third class of medications that we're going to talk about is the thiazolidinediones. These are medications like the Vandia and the Actos some persons may be on. So, how these medications actually work is that they decrease blood sugar by improving the cell's sensitivity to insulin. So it actually makes the cells of the muscles, the cells of the tissue more sensitive to the insulin, so the insulin can actually work better into the body. Now the class where we talked about before, which was the sulfonylurea, they actually make the pancreas produce more insulin or stimulate the pancreas. And the one that we talked about first, the glucophage, it actually reduces the amount of sugar that's actually produced by the liver. So all of these different medications actually work differently. So because of it, a lot of them can actually be used together in combination. So some persons may ask, well, why do you have me on 3 or 4 different blood sugar medications? Don't they all do the same thing? Don't they all? But each of them actually have a different mechanism. So if your blood sugars aren't to the level where we need them to be, then we can add another one to assist along with your diet and exercise.
What about
Janumet? I'll talk about that shortly, but Janumet is a combination medication. So it has 2 medications in one. So like I said, these are the medications, the thiodiones, medications like the Avandia and the Aptos. Some time ago, Avandia was in the newspapers, articles, and everything else about it. Good medication, but it was actually in because it causes some problems with the cardiovascular, with the heart system. So because of it, now it's advertised for anybody if you have any type of heart problem or heart compromise, and to speak to your doctor first or let your doctor know before going on this medication. Because of that, because it wasn't marketed, because it wasn't known, it caused the medication at first to be taken off the market. Now it's back on the market. A very good medication, FDA approved. It's just not for persons who actually have heart problems. Like I said, it's indicated for persons with type 2 diabetes. It can be actually taken once or twice a day. It can be either taken with or without food, and like with all the medication, begins to work in about 2 weeks, but you see the full effect after about 3 months. Now, like I said, the Avandia or the Aptos can be found to actually decrease your A1C by up to 1.4%. The reason why this medication is not to be used for persons with heart problems is because of one of its side effects. So one of its side effects is that it causes fluid retention and it causes edema. Edema is just swelling. So if you have a problem with the heart has a problem already pumping the amount of fluid that is there. And if this medication causes more fluid to be there, then it puts a greater strain on the heart. So persons with any type of heart problems, this medication is not recommended because of those two side effects. So for persons who are actually postmenopausal, this medication can be known to make them at a greater risk of becoming pregnant, especially if they're still having their menstruation. And also is known to increase the risk for problems with bone fractures in women, especially women who are actually postmenopausal or not seeing their period any longer. So this medication also has added benefits. It actually decreases the triglyceride, which is a cholesterol which causes heart problem, and it actually improves your HDL or your good cholesterol. But along with that, it also has some disadvantages. The main disadvantages is that it causes a possible weight gain for up to 2 to 6 pounds, and that's because it causes some bit of fluid retention or edema or swelling. So that fluid has weight, so it can cause a weight gain of up to 6 pounds. And it could also cause a slight increase in your LDL or your bad cholesterol. So we discussed those first three. Now it brings us to the fourth one, what we call the glutamides. So these type of medications actually help the body by releasing insulin at the start of the meal and help control your blood sugars. So these medications can be taken anywhere from once a day to up to 3 times a day to help control your blood sugars. These are medications like the Starlix and the repaglutamide, or sometimes it's known as the Novonorm. These are the same medications that you can actually use. It's actually indicated for persons with type 2 diabetes. Usually take 1 tablet at least 30 minutes before a meal, and it starts to work within 20 minutes, and the effect of it lasts for up to 4 hours. It can be taken in combination with other diabetes medications. And some of the common side effects are: 1, it can cause the blood sugar to drop low. It can cause joint aches or pain in the joints. It can cause some dizziness or flu-like symptoms. And with everything, a lot of these side effects disappear after about 2 weeks on the medication. Like with all your tablets and all your medications, they're supposed to be stored at room temperature. But this medication is not taken if you have any problems with the liver. Like I said, anything that you take into the body, whether it's bush medicine or anything like that, is either broken down by the liver or is broken down by the kidneys. This medication is actually broken down by the liver. So if you have a problem with the liver, then this medication is not recommended because it can be broken down into the by the body. and is not recommended for persons with type 1 diabetes. So now we have another class of medication called our alpha glucosidase inhibitors that work completely different from all of the other medications. This group of medications is similar to the medication called acarbose. How this medication works is that when you eat, you have a meal, it actually reduces the amount of carbohydrates that's absorbed into the intestines or by the intestines into the bloodstream. So it allows less food to be digested and more food to pass through. So less food is digested, less carbohydrates are broken down, and there's less sugar into the bloodstream for the body to actually have to deal with. So this is how this medication works. Now it's indicated for persons with type 2 diabetes. It's not approved for use in children. But this medication is usually started slow and gradually increased. It can be taken as much as 3 times a day, but it's usually started once a day for a week and then gradually increase until you get to the levels that you actually need it to be. Because of how this medication works, it actually allows a lot of things to pass through and not to be worked on. This medication is usually not taken within 2 hours of any of the other medications. So the other medications can be able to work effectively. So for this and all medication, you have to have your blood test, your liver enzymes, your kidney function tests done periodically at least once a year to make sure everything is still working and in good order. Some of the side effects of this medication are: 1, it can cause your blood sugar to drop low. Even though this medication doesn't produce or doesn't increase the amount of insulin being produced, because it causes more carbohydrates to pass out, so less sugar being absorbed, because you have less sugar being absorbed, it can cause your blood sugar to drop low. Other problems this medication can cause is it can cause diarrhea, abdominal pain, and flatulence, or passing a lot of gas. The reason it can cause that is, again, it actually causes a lot of the food not to be absorbed, so more of the food goes into the large intestine. Large intestines are really just made for after the food has been digested to deal with that. So because you have this large amount now entering the intestine, it causes the large intestines to be a little more swollen or bigger than usual just because of the food passing through. So a lot of times you can actually feel bloated. Because of that extra stretch and bloating, it can actually cause you to have some pain or feel some pain in the belly. Also because you have more of the food that wasn't digested in the large intestine, and you have bacteria throughout your whole intestinal tract, there's more things for the bacteria to work on. And because they're working on it and they're releasing gas when they do it, it causes persons to have more flatulence or they pass gas more. And this is one of the main side effects of this medication, the acarbose, that most persons don't like. Come back after a week and say, every day just passing gas, and you can't control it, and then you go out, you go around person. So, have to know about the side effects. Another class of medications is what we call the DPP-4 inhibitors. These are medications like the Januvia or the sitagliptin. How these medications work, they work different. Okay, like I said before, the pancreas produces insulin. That insulin helps to move the sugar out of the bloodstream and into the cells which need the sugar for energy. Now, the body has a way of making sure everything stays equal. So after the insulin comes, moves the blood sugar out of the bloodstream, puts the sugar into the cells. The body has a way to get rid of the insulin because the insulin is no longer needed. So these are called the DPP-4s, which the body actually sends to move the insulin because the insulin is no longer needed until you eat again, and the pancreas produces more insulin. So what this type of medication does is it stops the DPP-4s from actually working. So it actually allows the insulin to stay in the bloodstream longer. So once the insulin is in the bloodstream longer, then it can work harder and it can work longer to actually move the sugar out of the bloodstream. And this is how this group of medication works. Now, like I said, this medication increases insulin blood sugars, increases insulin when the blood sugars are high. But this medication is also what we quote unquote call a smart medication. So if your blood sugars are high, then it works more by stopping the insulin from being broken down. If your blood sugars are low, then it doesn't work, it stops from working, so it doesn't cause the insulin to stay longer to cause you to drop low. It reduces the amount of sugar also produced by the liver after you eat, and is actually found to be able to decrease your A1C by up to 1.5%. And it mostly improves your fasting and your after meals blood sugar levels. So this medication, because of how it works, it rarely causes your blood sugar to drop low, because once it sees the blood sugar high, then it starts to operate. When the blood sugar drops low, it actually backs off. This medication is dosed once a day, and it's usually taken with or without a meal. And this medication is one of the medications what we call weight neutral. So it doesn't cause you to gain weight, and it doesn't cause you to lose weight. The class that we talked about before, the thiazidines, the one that cause increased fluid, actually cause you to gain weight. The first class that we talked about, the metformin, the bigonide, those class of medications actually cause you to lose weight or to be a little smaller. The most common side effects from this class of medications are it can cause runny nose and headaches, but like I said, a lot of these side effects disappear after about 2 weeks. There's also been reported that this class of medication can cause a condition known as pancreatitis. Pancreatitis, the pancreas, like I said, is the organ in the body that actually produces insulin. It can cause it to become inflamed. If that happens with this class of medication, then this medication has to be stopped or discontinued. But to date, I've not seen anyone with pancreatitis from whom I'm seeing related to this class of medication. But it is stated as a side effect. The vitagliptin is the Galvus, similar to the Januvia, but just another medication in that class of medication. And it works the same way and does the same thing. Now, I had a question about Janumet. Janumet is actually a combination medication. So it has the Januvia along with the metformin combined. So it's actually 2 medications in one. And they found that that combination actually works good together, so they could have compiled it in one tablet. And it works good in terms of decreasing your A1C. And they found that with the Janumet, as opposed to each one separate, let's say the metformin decreases your A1C by 2, and the Januvia decreases by 1. Added up together equals 3. But they found out that when you have that combination with the Janumet, the Januvia, and the metformin, for some reason it actually has an added effect, and it even decreases your A1C even more than each one of those if you had them separately. So it's a good
What about weight gain or weight loss with Janumet?
weight neutral. Doesn't cause you to gain weight, it doesn't cause you to lose weight.
Can you switch me with something to make me gain weight, please? Anyway.
I love your size. The last class of medications that we will deal with are ones called the SGLT2 inhibitors, or the sodium glucose transport inhibitors. These are one of the newer set of medications that are out. Medications such as the Forxiga, the Invokana, and all of those are part of the SGLT2 inhibitors. Now, how these medications work, they work differently. Like I said, SGLT2 means sodium glucose transport inhibitors. So how everything is supposed to work is that you eat food, stomach breaks it down, goes into the intestine, is actually brought into the bloodstream. Bloodstream takes the sugar, uses the sugar, reducer the insulin to take it to the cells which needed for energy. Now, the sugar which is still left in the bloodstream has to go through the kidneys. Kidneys have to clean out everything and filter everything. When it actually goes through the kidneys, now the purpose of the kidneys is to filter the blood and clean it up. But how it's set up in the normal body to work. When the sugar actually passes through the kidneys have a port or somewhere for the sugar to actually go back up. So it goes back into the bloodstream in circulation. So the sugars can actually be recycled. How this medication works is it stops the sugar from being recycled. So because the sugar isn't being recycled, then the sugar has to be excreted into the urine. So it helps in lowering your blood sugar by that way, by not allowing the sugar to be constantly recycled in the body. So because of this, if you ever have your urine checked, if you're on this medication, your urine will always show high amounts of sugar because the sugar is being passed out into the urine. And a lot of the side effects are actually due to that. Because it actually lowers the amount of blood sugar, that actually causes you to have improved sugars and improved levels. Now, some of the side effects because of it is that because you have more sugar floating through the bloodstream, you have increased risk of urinary tract infections. For women, you have increased risk of yeast infections. You also have the possible risk of problems with the kidneys because of it. You also have increased risk of possible cancer to the bladder, but it's only with this particular medication, on this particular medication in this class, which is the dapsone. So that excludes the Invokana and the placebo. And it's also used for caution in persons who are older and persons who have a poor kidney function because it's actually passed through the kidneys. The reason this is used with caution in persons who are much older is because it causes more sugar to be excreted into the urine. Water follows sugar, so you actually lose more fluid like that. So for persons who are older or elderly, they run the risk of getting their blood pressure dropping too low because they're losing a lot of fluid because they're urinating more frequently. This class of medication, like I said, it's also being shown to actually cause a decrease in person's blood pressure because it causes you to lose more fluid. So a lot of times if persons are on blood pressure medications, your blood pressure medications may have to be adjusted or decreased because this medication also helps to decrease your blood sugar. Because you're losing more sugar or the sugar is not being recycled, a lot of those calories are actually sent out in the urine. So it actually causes persons to have some bit of weight loss because a lot of the calories aren't recycled, but it's excreted in the urine. And it also has a low risk of hypoglycemia, your blood sugar dropping too low, but it can cause it. So, this is a busy slide. What it actually just shows is that when somebody walks into the office, has a high blood sugar, what actually goes through our minds to figure out if we want to put persons on one medication or a combination of medication, and what choices we make in order to choose which combinations to use. And it actually depends on a whole lot of things. One, it depends on financial status, how much money you have, because certain medications cost more than others. Two, it depends on the side effects of the medication. Some of the side effects people don't want, some of the side effects people do want. So it depends on the medication and if you have any side effects to the medication or if you mind the side effect. Three, if you have any problems with the kidneys or the liver, would actually limit the medications that we can actually choose from. And also depending on how high your A1C is or how high your value is, would determine which medication is best or we would prefer to use. So a lot of things actually have to go into choosing the medication, and a lot of things we actually have to consider and think about to choose the medication. Me personally, I usually do meal. I showed a list of medications that we have, the ones that I think would be the ones that we should choose from because they are more recommended or would decrease the A1C better, and then have the discussion about which medications we would use. What we will do if we don't see the values where we need it, or if we have the values where we need them and they go low, how we can actually decrease and see if we can decrease the medications in that same regard. But these medications have to be taken in use with you exercising and plus eating appropriately to actually allow the medications to be effective. Because each medication can only do so much. So let's say if we're on one of the medications, let's just pick one, Metformin. If the Metformin can decrease your sugar only by this much, this is the amount that the Metformin can decrease your sugar if you on the medication, and you continue to eat this much, then the Metformin still won't be able to actually help to decrease your blood sugar. So everything also has to be taken into the fact that you have to be eating right and exercising to actually assist in having everything work appropriately. Sorry. So now, as we know, diabetes pills are not for everyone. Effective only for most of the cases if your pancreas is actually still capable of producing insulin or is working. So it means that some people, mostly persons with type 1 diabetes, cannot use the oral medications and should be on the insulin medication. The good news is that we have a whole cadre and number of medications to actually choose from, because I just showed you 7 different classes, or 7 different medications, or groups of medications that we can choose from. And because they actually work different, their action is different, we can actually use them in combination to try and get the blood sugars to the level that we need them to be. So for some people with type 2 diabetes, diabetes pills are actually used in combination, like the Janumet, which is a combination between the Metformin and the Januvia, but they have many other combinations of medications that they have there. And this is done to actually have an added effect and actually help to reduce your blood sugar levels. So our overall goal is to actually help your body use its own insulin more effectively, or if that is not possible, then we have to give the body insulin to actually use if needed. So now that brings us into our injectable medications, are the ones that we stick with. Any questions on the tablet before we move to injectable? Cool. So injectable medications, like I said, these are the ones that we have to use a needle to stick with. But there are 2 types of injectable. One group, which is non-insulin based, and the other group, which is actually insulin based. So the first set is we have our non-insulin injectable medication. These 2 are the incretin mimetics and the mimetics. Now with the incretin mimetics, how they actually do is these drugs limit the incretin hormone found in the body. So how this works is it actually works by increasing the amount of insulin that's actually secreted. And it helps the beta cells in the pancreas to work better. Along with that, it actually slows down the food that is released from the stomach into the intestines, because if the food is released into the intestines at a slower pace, then it's actually, the sugar is actually sent into the body at a slower pace, because it's less sugar at each time. And this medication also, for a lot of persons, make them feel full a lot quicker. So it also causes them to eat less, which is good. These medications are certain medications like the Dieta. And like I said, this medication is not insulin, but it is an injectable. It's usually administered 30 minutes prior to your morning and evening meals. Administered in the upper arm, the thigh, the abdomen. And it actually, you can take with other medications within an hour of taking the Viagra. The reason because I said it actually slows down the amount of food being released. So you don't want you to take your medications at that same time for it to slow down the other tablets or oral medications that you may be taking. So this just shows the different ways at which the Viagra works. One, it works at the level of the kidneys to stimulate the beta cells to make them produce more insulin. Two, it works at the level of the liver to allow the liver to produce less sugar, so there's less sugar in the bloodstream for the body to deal with. Three, plays a role at the brain by making you feel fuller quicker. So because you feel full quicker, you eat less. If you have less food, then there's less sugar in the body. And four, it works at the level of the stomach by allowing the food to be released into the intestine at a much slower rate. So the sugar can be sent into the bloodstream at a slower rate, and the body is able to deal with a small amount of sugar at one time rather than a big rush of sugar at one particular time. So like I said, these medications, these are injectables. Before you use the medications or the pens, they actually have to be stored in the refrigerator. Once you start to use them, they can be stored at room temperature. Pens, all these pens are only good for 30 days. After 30 days, don't care how much you have left in the pen. You discard, you get a new one, and you start all over again. If your pen gets frozen, you have to discard it and throw it away. And also not to store your pens with your needles on it, because this can cause you to have air bubbles, and that can actually be dangerous if it's in the pens. Now, this medication, the Viagra, is known to decrease your A1C by up to 2.1%. Because of how it works, like I said, it causes you to feel fuller quicker and everything else like that. It can cause a weight loss of up to 11 pounds, which is good. You don't want that medication.
No, I don't.
Again, and the most common effect with this medication is that it causes nausea or make you feel like you want to vomit, but that usually decreases over time. And this medication is only indicated for persons with type 2 diabetes. Now, the immunomimetics can be actually used in combination. This is the other class of injectables with non-insulin. It can be used in combination with other oral medications or with insulin itself, and it's used with the meals to actually, and it works by actually prolonging gastric emptying, the same way how the Viagra slows down the amount of sugar or the food moving from the stomach into the intestine. So it works the same way by slowing that down, so it's less sugar for the body to deal with at any given time. And also works to make you feel fuller quicker, so you actually eat less. Again, this one is not insulin and is not used to replace insulin, and is used the same way to actually help and decrease your blood sugars. This medication can cause or may cause your blood sugars to drop low, and if it's going to occur, usually it occurs within 3 hours of taking this medication. So you actually have to monitor your blood sugar with this one. And the most common side effect from this medication is that it can make you feel nauseous or like you want to vomit. Some of the benefits is that it causes fewer blood sugar swings throughout the day. Like I said, it makes you feel fuller, so you actually eat less, which in turn can result in you losing weight. And with this medication, you may not need as much insulin if you're on insulin also. So now it brings us to our second class of injectable medication. And these medications are insulin. So now insulin is a hormone that's actually naturally produced by the body. It's produced by the pancreas to actually help and lower your blood sugar or move the sugar out of the bloodstream into the cells. So for persons who actually are not producing any insulin, they would need another source of insulin, which they have in the injectables, and we give them the insulin to help the body move the sugar and deal with the sugar. Otherwise, their blood sugar will continue to rise and rise and rise, until it causes some complications like a coma or what we call diabetic ketoacidosis. So it's better to have your blood sugar controlled. So, try and make this short. There are different types of insulin, and different types of insulins are actually ordered by how long they last. So you have the rapid acting, the short acting, the intermediate acting, and the long acting. So the rapid acting are the ones that are very quickly. They usually start to work within 1 to 30 minutes of taking the medication and can last for up to 2 to 6 hours. These are medications like the Preda, the Humalog, the Novolog. The Zubra is also another type of this medication, but the Zubra is one of the mist or spray medications. You also have the short-acting insulin. These take a little bit longer than the rapid-acting to work. These usually work after 30 minutes to an hour and can last up to 8 hours. And these are medications like the Humulin or the Novolin R. After that, we have our intermediate-acting medications, which actually start to work in 1 hour and can last up to 4 hours. Start into 1 to 4 hours to work and can last up to 16 hours. And these are medications like the Humulin and the Novolin N. And sometimes they have combinations of the two medications, what they call the Novolin 70-30, which have an intermediate and a short-acting medication mixed together in one. And last, we have our long-acting medications. These medications start to work after an hour and can last up to 24 hours in working. So these medications here are only taken once a day. Intermediate acting are usually taken twice a day, and the short and rapid acting can be taken as much as 3 times a day. So the long acting are usually medications like the Lantus, the Levemir, and we have some new ones like the Tresiba and all those medications that we have at our hands to possibly use. Now, just to tell you some of the myths of insulin, myth number 1 is that insulin should be used as a last resort of treatment. That is not true. In some cases, guidelines state that if your A1C is above the double digits, then insulin should be a first resort to actually try and bring your blood sugars down as quickly as possible to prevent the amount of complications that can happen. So sometimes insulin can be used first and is not a last resort. And don't think of insulin as a dead sentence. Like I said, your body produces insulin. Insulin is naturally produced by the body. And sometimes the body needs an extra source of insulin to help it do the work that it needs to do. And it has to be given through the injectable form. So, myth number 2 is that insulin injections are painful. Now they can hurt, yeah, but they're not that painful. They actually have a small needle and they're using smaller and smaller needles that you can actually use to inject yourself. And they're actually less and less painful. Myth number 3 is that insulin causes weight gain. Now with the insulin, you can actually gain a few pounds, up to about 2 to 4% of your body weight.
So that means
Anything.
that is, what's 2 to 4%? Like I
Depends
weigh
on how
like
much you weigh.
110, like how much that is now?
If you weigh like 110, that's like about 10 pounds.
Okay, that's my original weight. I used to weigh 130 pounds before I got
You want
that.
to get higher?
I want to gain weight.
I say may.
Oh, May. Oh.
Not
May.
will.
Okay, let me go back.
Not will.
Oh, May.
May. But the benefits of being on insulin far outweigh the risk of gaining weight. Any weight that you gain over that amount is not due to the insulin, but due to the hand and the mouth. Now, like I said, a lot of these injectables or insulin actually come in a pen form. The pen are nice and handy because you can keep them in your pocket, keep them with you. Persons don't know what it is. They think it's a pen. They don't have to actually know why you're taking that medication, what's it. So it's easy to carry around with you without you feeling any type of discomfort. The pens even have a smaller needle than the actual syringes. have. So it's even smaller, thinner, less painful, and it actually has different ways to ensure your correct doses because it has a click that goes every time you change, so you can have the number of your insulin, and even if somebody is blind, they can actually use it and hear the click so they can know how much units they're supposed to give themselves.
What's the average cost of that?
Depends
Locally, yeah, average cost.
where you getting it from.
Let's say Lowe's or.
If you're getting it the Lowe's, the insulin, the Humor would probably be around about $60–70.
And how long that's supposed to last?
It depends on how much insulin you want. Because each pen has up to about, depending on the type of pen, usually about 100 units. And they usually come with 5, so that's like 500 units you get at one time. The Lantus, or the long-acting medication, or Levomed is also in pen form, and that one is a little bit more expensive, somewhere close to around $99 or somewhere around.
Princess Margaret Hospital have it?
Yeah,
It
but it
does?
has it in, it has it only in vial form.
I don't know that.
Little bomb.
It has it in the bottle. It doesn't have it in the pen form. So
Oh.
you'll have to use it when you need it.
Oh no. Okay, go on.
So because of that, because you could use the dial, the count, and hear the click, it actually ensures that you give the correct dose, and once you give the correct dose, it automatically zeroes, so you can check to make sure that all of the insulin has been given. Because they're fast and easy to use and easy to store, there's little preparations to actually do for them. So it's a good choice if you're using it. This just is a small schematic diagram to actually show you the difference between the different types of insulin. This is the long-acting insulin, like I said. It causes a secretion of insulin into the body at a slower rate over a 24-hour period of time. So there's a little insulin going in to actually help and bring down all your sugar levels. So the Lantus or Levomed long-acting ones help and decrease the sugar levels throughout the entire day, and it brings everything down. The intermediate ones that I talked about, like the Novolin 70/30, the ones that you can actually take twice a day, they actually have a peak where they start to work after about 10 to 12 hours and then start to go down. Now, this medication is on twice a day. By the time this starts to go down, it's about time for your second dose. So by the time it's your second dose, you see you would never have it dropping too low. So you'll always have some form of insulin in the body to work on whatever you're eating. And like I said, the fast-acting insulin start to work quick and finish quick, but these are actually taken with each meal. So whenever you eat and have that nice sugar spike, these medications work quickly to help and bring them down and move the sugar into the cells so they can actually be used. So it just shows you the combination when you're using, like I said, the 70/30 to twice a day. When you have it when it's coming down, the second dose is actually going up. So it allows your levels to actually kind of stay constant. And the ones that you actually usually take 3 times a day with breakfast, lunch, and dinner is usually taken along with the long-acting insulin. So the long-acting insulin acts as a baseline throughout the whole day. And these spikes only work for when you actually eat that meal to help and bring the blood sugar down at those times. This just shows you all the different points and parts of the body that persons can actually stick themselves. If you have to use the needle to stick yourselves, and to actually stick yourselves in different parts and different points each time. So, some of the things to be cautious about with insulin is that because it's insulin and insulin moves sugar, it can actually cause your blood sugar to drop low, and it can actually cause it to drop very low. Very low is what we call below 40, and below that range, it can actually cause seizures or even coma. So persons on insulin have to measure their blood sugars to see how it is, so they can know the levels of their blood sugar on the medication. After about a month or so of measuring your blood sugars with the medications, you actually know how the medications will work, and you can have an idea of how your blood sugars will run with the medication. Also, it can possibly cause edema or swelling with the insulin, and it can also cause something known as lipoatrophy or lipohypertrophy, where you stick yourself. What that means is it either causes, sometimes if you continue to stick yourself in the same spot every day, it can cause fat to build up in that part, or it can cause the fat to disappear. So sometimes persons, if they stick themselves in the same spot every day, but find that they actually develop a lump in that area where they stick themselves all the time. So that's why it's good to actually continue to switch your injection site all over. So we usually say, imagine you have a clock written on your abdomen, and you just go around, so you don't actually end up sticking yourself in the same place over and over every time. Now, some of the contraindications or the reasons why we won't use insulin is if it actually causes your blood sugar to drop too low and causes it to drop too low all the time, or if you're allergic or sensitive to any of the ingredients in the product. This just goes through the four different classes: the rapid, short-acting, immediate-acting, and long-acting medications. Just saying how they work, how long they work, and the different types of medications that we actually have, and that most of them actually come in a pen form that you could use, where you have the dial with the click, which would give you the number of how much units you're on, and then when you inject yourself, it actually zeros. And this is the actual insulin injection that goes in it, and this one is a U100. So for this one, it only has 300 units of insulin in that cartridge. Some of them have U300, which has 300 units of insulin, and depending on how much units you are on will determine how long one pen would last you. So if you're on 10 units and you have the 100 unit pen, then it would last you 10 days if you're only taking it once a day, just so you get an idea. The Exubera is one of the medications that can be used as actually an inhaled medication that can actually be used to help and decrease your blood sugars. But this medication can cause problems if you have any type of lung problems, asthma, anything like that. This medication is not recommended to be used. Okay, and we go through all of these. The short acting, like the Humulin R and the Novolin R, which means regular, that you can actually use, which are the short acting, and then we have the intermediate acting, like the Humulin and the Novolin N, which can actually be used. And then our long acting, which work for 24 hours, such as the Lantus and the Levemir, which both come in a vial form, and it comes in a pen form. And these medications can be stored in the fridge until they're first used. Once they're taken out the fridge and used, it's good for up to 30 days. After that time, they should be discarded, and you should get a new one and use a new one. So you shouldn't be using one same pen for 2 and 3 months. And these are the different types. Now, I know a lot of times a lot of persons are into natural medication and want to know what natural things people can actually take in order to use to actually help and decrease their blood sugar. The problem with natural versus the pharmacological medications that we actually choose and prescribe is that the medications that we use and prescribe, the pharmacological ones, we actually have to go through different trials and different tests to actually make sure that they actually work. Those tests actually help us to find out the different side effects of the medications that they can cause, how long they work for, how well they can actually decrease your A1C value. The test also allows us to know how often you should take the medication. And so, because of it, we have a good idea, we feel comfortable with the medication because we know what possible side effects, we know what to watch out for, we know what to look for with those medications. Well, a lot of the herbal medications, they haven't been studied to that effect, so we don't know what dose it is you use, whether you need 1 1 cup of aloe or 2 cups of cerasee to use, whether you have to take it once a month, once a year, every day. Those questions we don't have answered. And because of it, we also don't know which level of the herbal medicine is actually can be or may be toxic to the body. Because anything in too large amount can be actually harmful to the body. Even if you drink too much water, it can actually be harmful to the body. So because we don't know the doses and the amount which should be used, how long they should be used, we usually err on the side of caution when we talk about natural medications or using any natural thing to actually control your blood sugar. Because we know everything is litigious now. You take it to court and sue and everything else like that. So everything that we practice actually has to be evidence-based. So we actually have to have evidence and studies that prove that this should be used and this is what this does. This is the possible side effects and everything else like that. So when you come and say, hey, I've been using this and now I have this, we could say, okay, yeah, this is because of this medication, because it can cause this, or no, I don't think that's because of this medication. We have to try and find out what else may be causing it. So it gives us a better idea of how to work, unlike a lot of the natural substances. But just so you get an idea, some of the natural substances that they actually show to actually help blood sugar are your vitamin B12. Vitamin B12, especially if persons are on the Metformin or the glucophage, that medication itself, after a while, sometimes in some persons, can actually cause your vitamin B12 to actually go low. So if you start to have that numbness or tingling, that may be because of that, and you may need vitamin B12 added. But some of the other things are the vitamin B3, the vitamin D, E, carnitine, coenzyme Q10, magnesium. The good thing with a lot of these things are they're found in fruits and vegetables. So if you eat a lot of fruits, variety of fruits and vegetables, you can get a lot of these in your body naturally rather than having to take supplements for the magnesium and all these other things if you just eat appropriately and eat